My name is Gina Venditti, and I'm a physician assistant, and I'm representing the PA Foundation today as we talk about influenza.
And my name is Adam Welch. I'm a pharmacist, and I'm here on behalf of the American Pharmacists Association.
I'm from Tampa area, so not too far away from here in Orlando, but yeah.
And I work for East Tennessee State University at the Gatton College of Pharmacy in Johnson City, Tennessee.
Yep, so that's a great question. So they're both viruses, but influenza is a virus that certainly is more prominent certain times a year, and it has different symptoms than a cold does. So influenza, where you get a cough, you get that fever, you get those body aches. So it definitely has different symptoms than the typical cold. They both are viruses, so they're spread the same way. Somebody coughs or sneezes and you can get the virus on your hands, which is why hand washing is so important this time of year. So sure, so some people are just going to be at a higher risk. We know as we age, specifically the older population, 65 and older, our immune system does decline in its ability to prevent infection and ward off infection. So you will be more susceptible. Plus, people that are 65 and older have other comorbidities, meaning they may have diabetes or heart disease and other things that would make them more susceptible to getting influenza, having worse symptoms, and having it longer. That is correct. There is a flu season. Usually starts August, September, and it goes to the beginning of the next year, March or April. And that's just because that time of year, the weather, that just it factors into that virus being able to replicate more. So seniors are definitely more susceptible for a couple reasons. Number one, again, is that immune system that is not as strong as it used to be. So somebody who may come in contact with the flu, they can't fight it off as well. They may have those other comorbidities. They may be on other medications, things that could also affect their immune system. And so, yeah, they are the group of people that are certainly more susceptible to the flu. I think one staggering statistic is that 90% of flu-related deaths in the country every year are in patients 65 and older. Yeah.
Well, the flu vaccine, what it does is it helps your body recognize influenza in real life. It contains proteins and bits and pieces of a virus that your immune system can recognize, and then if you were to get exposed to influenza in the future, your body can fight off the infection much faster. The flu vaccine is the single best way to help prevent influenza each flu season. It's not too late to get your flu vaccine. Flu vaccines should be given ideally between September and October. However, you can continue to receive the flu vaccine if you haven't already received it into later months, December, even over the new year, January and February, because we don't know when influenza will hit a particular community that you may be living in. So getting the flu vaccine anytime during flu season is important.
So some of the preparations of flu vaccine are made with certain components of egg. I can tell you this year there is a preparation that is out that does not have eggs in it. So you can certainly check with your healthcare provider about that or your local pharmacy, because there is a preparation out there that none of it has any kind of egg component in it that's used as part of the solution and preservative.
I think what people don't always realize is that there are about a dozen different brands of flu vaccine available on the market. And so there are plenty of options. We know that about 50% of adults will get their flu vaccine from a doctor's office, and about 25% of adults will get their flu vaccine from a pharmacy. So the flu vaccines that are available can be given in either setting, and it's just important, again, to make sure that everyone gets a flu vaccine. Anyone 6 months of age and older receive it every season. Well, first you can talk to your healthcare provider, as we mentioned. Alternatively, you can go to vaccinefinder.org to get more information about locations for vaccines. I think it's important that everyone receive the flu vaccine every year, and there are some particular vaccines that may be more useful for patients 65 years of age and older, because as your immune system declines as we age, there are some specially formulated vaccines that help create a stronger and more robust immune response in that age population. So everyone needs to get the flu shot each year, and there are some options for specific populations. Thanks for having us.
Thank you.